Welcome back to this week's episode of Hormones, Metabolism, and You. I'm your host, Dr. Cassie Smith. I'm a functional medicine endocrinology doctor based out of Oklahoma City. Today, I am doing a solo podcast episode, and I'm going to teach you guys all about the 6 gut health types that I have found in my practice. So I do a live webinar once a month where I help people connect all of these symptoms that they have to their gut. I think one of the reasons that so many people are ill in the United States and just chronically fatigued and gaining weight and not feeling better is because most doctors and providers do not understand how to look at the big picture and how to take all of these symptoms people have and go back to the root cause, which most of the time is the gut. Because of that, and because of what I've seen after treating thousands of women and men, I developed a course. I developed a protocol and a program at our office that we call the Gut Health Accelerator. And I trademarked 6 gut health types that I have found in thousands of people. And in doing so, what I realized is that until you fix someone's gut, truly heal it, most people are not going to get better. Their hormones are not going to get better. Their thyroid is not going to get better. And they will continue to have insulin resistance, inflammation, and get more and more disease processes, which when they go to doctors will Band-Aid and they will give different medications and different treatments for all of these different symptoms. And so I get people who come to me every day on multiple medications, multiple anxiety and depression medications, blood pressure medicine. And people have just given them a medication every time they go in with a symptom, instead of really sitting down and looking at them as a whole and saying, like, what is causing all this? What is driving their insulin resistance? What is driving their inflammation? What is driving their hormone imbalance? What is driving their thyroid antibody to keep getting higher even though their blood test looks good? And so I became frustrated not only as a patient, but also as a provider. And so I went to the gut, because Hippocrates said 2,500 years ago, let food be thy medicine and medicine be thy food. And so when you look at the gut, what I have found is that when you fix someone's gut, you truly heal it. Their hormones get better. Their hormones are able to go into the cell. That includes estrogen, testosterone, that includes progesterone, thyroid hormone, and people actually start to get better, and they feel better too. So symptoms are important. And I know that we use labs as a guide, but symptoms are very important. And so I have patients who I've healed without fixing their gut, but I have many who say that they're improved, but not 100%. And most of the time it's because they have an underlying gut issue. And so I'm going to explain to you why that is today. And I'm going to start you on a journey of the 6 gut health types. I don't think we're going to get through all of them, but I'm going to do a second episode where we do get through all of them. And I want to just walk you guys through how your gut is so related to your hormones. And when we're finished, hopefully you have some more answers and you don't feel so just discombobulated, because I know a lot of people reach out to me on social media and say, I feel like my provider's not listening, or I feel like I have all these symptoms, or I've tried all these things and nothing's working and nothing's getting better. And so I want to show you why a lot of times when you've tried all these things, you aren't getting better. It's because no one's looked at your gut. And for those of you who are listening and saying, well, I have worked on my gut. I've seen someone with my gut. I've done a GI map. I've done all sorts of different, testing with my gut. I've done gut protocols. I follow a gluten-free diet. I still want you to listen. Don't stop listening, because what I'm going to teach you is that everyone's gut is unique and everyone's gut is different. It's as unique as your fingerprint. And so if you're using generic protocols and somebody really doesn't know how to look at every single piece of your gut, then they can miss things and you won't get better. And if we use generic protocols on people, a lot of people won't get better, because not everything, like what heals my gut may make your gut worse. It depends on the entire picture. It also depends on my autoimmune process, my labs, my sleep, my stress. And so I just want to take you guys through a little journey and help you realize why your gut is so important. Okay. And I actually wrote a book about this. Those of you who follow me know the book was ready to be published. There's a little something exciting that's happening, so I'm waiting. But the book is so good, and it talks about all of this. And it's really helped me understand why I couldn't treat so many people and make so many people feel better for so many years. And it's because nobody wanted to talk about their gut, or people didn't think their gut really mattered. Or when you talk to somebody about their gut, people think, oh, well, I'm not going to eat gluten-free, and I'm not going to not eat what I want, and I'm not going to not drink alcohol, and I'm not going to not drink my coffee, so I'm not dealing with my gut. But what I want you to realize is your gut is really the central point of a lot of these symptoms. So I'm going to walk you through this. And then after that, maybe we can re-talk about your gut again. So if you're listening to this right now, I want you to think about this. Can you relate to these things? So can you relate to being told that everything is in your head or that you're just stressed out, right? Have you ever heard somebody say like, oh, it's all in your head or you're stressed out when you go to a provider? Have you ever woken up after you've slept for 8 hours and been exhausted? And you're like, how can I be tired? I actually slept 8 hours. Can you relate to that? Can you relate to the fact that you're trying to do something and you feel like your brain is like wrapped in cotton? You're just like, why can I can't do this task. Like, why? It should be easy. It's something I do all the time. It feels like I have like, I don't know, saran wrap or aluminum foil in front of me and I just can't get this task done. Or maybe you're somebody who says, you know what? When I wake up in the morning and I look in the mirror, it doesn't matter if I haven't even drinking water, my gut is swollen. Like I feel bloated, I look pregnant. It doesn't matter if I do a 24-hour water fast, I look bloated or swollen before I've even eaten anything. Or are you someone who every time you step on the scale, it doesn't move? Despite the fact that you eat less than your friends, you're doing exactly what your trainer says, you're eating your protein, you may even be microdosing GLP-1s and your weight is not moving. So if any of those things you can relate to, or, multiple symptoms, brain fog, irritability, anxiety, if you are struggling with any of these things, or you're a fellow Hashimoto's patient like myself, and you just can't get your labs where you need them to be, or you're taking hormones, but even though you're taking estrogen, progesterone, testosterone, or thyroid hormone, still your levels are not where they're supposed to be, and you just don't understand, or your antibodies are not going down, you really, really need to listen to this podcast and the sequel to this, because I'm going to teach you that the reason you haven't been able to fix it is because nobody's fixed your gut. And if you think I'm crazy or you don't believe me, then think back to all the things you've done. You've tried the diets, you've tried the probiotics, you've tried the medications, you've tried the fasting, you've tried the morning routines, you've tried all the things, and nothing's gotten better. But have you truly looked at your gut and known exactly what gut health type you have, had a personalized plan that was like, we're going to do this, this, and this for 3 to 4 months? Have you then retested your gut to make sure you've cleaned out your gut? And if the answer is no, then I'm going to challenge you and say that's because you're still sick. I mean, that's why you still don't feel well. And so I put this together and I'm so passionate about this. And I do this every day because I have been there too. Okay. A lot of you know, like I had a health journey as well. I was really sick in medical school and residency. I had Graves' disease and then Hashimoto's. And then whenever I got out of fellowship, I just didn't feel well. And although I looked healthy and fine on the outside, I was like debilitatingly tired. I had a lot of mood issues. I developed PCOS. I had irregular menstrual cycles. I got insulin resistance. I had infertility issues. And everyone looked at me like I was crazy. I saw endocrinologists. I saw primary care doctors. I saw dermatologists. And everyone's like, there's nothing wrong with you. And I was a doctor myself. And it was so frustrating because I would sleep for 8 hours and then I would be trying to go to work and run out the door and I couldn't find my keys. And then I would be like, oh my God, my keys were right here. And then I would like end up crying and picking a fight with my husband and like, where are my keys? Because my brain was so tired that I couldn't even remember what I did with my keys. Or I would wake up and my stomach would be so bloated I couldn't even put on my jeans or my pants or even my scrub pants sometimes, and I hadn't eaten. And like I've always been the person who I'm done eating at 6 or 6:30. Sometimes I wouldn't wake up till 7 or 7:30 because I was so tired and I still couldn't put my pants on. And I'm like, why am I so bloated? I did 3-day fast, I did water fast, I did a 5-day Prolon fast, and I was still freaking bloated, y'all. Like I've been there. And I was told by everyone, well, your labs are normal, right? And I'm an endocrinologist and I'm like, well, you're right. They are normal. They might not be optimal. That's another discussion, but they were normal. And so I really did start thinking like, maybe this is all in my head. And people would be like, you look healthy. But what I want you to know is that you're not the problem. Okay. I wasn't the problem. You're not the problem. This generic one size fits all approach was the problem. So in medical school, in nurse practitioner school, in training in the US, we get like 1 to 2 hours of lecture about gut, if you're lucky, right? Like, and it's not like, oh, your gut health is tied to your hormones. It's like nutrition is important. Eat the food pyramid or some stupid shit like that. Like it's not even helpful, okay? Which none of that is actually true. The food pyramid almost needs to be like turned upside down, but there's no training. And so like, it's not you, it's this generic one size fits all that providers try to stick people into boxes. And that's why your problems can't be solved. But your gut is as unique as your fingerprint. And what heals your gut might not heal my gut. It might actually make my gut worse. And so if you're somebody who's been lucky enough to go on a gut journey with all your other chronic issues, then if you've done things and it hasn't gotten better, it may be because the person you were working with didn't know what they were doing. They kind of run everyone through the same, gamut of things, and they don't know how to adjust things when you don't fit like in a box, just like the rest of traditional medicine. But the cool thing about your gut is that it can heal faster than any other organ in your body. Okay, your gut turns itself over and completely heals itself almost every 30 days. All your cells in your gut your lining will rebuild itself. And so if you know exactly what's wrong with your gut and how to fix it, then you can make some pretty significant progress pretty quickly. So I want you guys to know that. So as we go through this, I want you to be thinking about what gut health type you are. I'm going to help you determine exactly what gut health type you are, because you have to know what gut health type you are in order to know how to fix your gut, okay? I'm going to help you understand why previous methods that you have done have failed you. Hopefully I'm going to teach you that. I want you to stop wasting your time. I want you to stop wasting your money. I actually want you to feel better, and I want you to feel very validated after you listen to this, okay? So before we kind of take off though, I'm going to list out for you guys some symptoms, okay? I'm going to start listing them. And as I list these symptoms, I want you to count. So if you're listening to this while you're walking or you're driving or you're running, just start saying yes, like 1, 2, 3, as you hear these symptoms. I want you to think about these symptoms, and then I'm going to tell you how all of these symptoms are related. But these are the symptoms I hear from my patients, okay? So here we go. Chronic stress. If you feel stressed, say 1, count it. Burnout. That's another one. If you feel burnt out in any way. If you have poor sleep. Cortisol dysregulation. So you've been told your cortisol is dysregulated. You've been told your cortisol is too high or too low. Weight fluctuations. Unexplained weight gain. Fatigue. Brain fog, anxiety, depression. Okay, all of those. Count. How many of those do you have? In addition to that, do you have constipation, diarrhea, IBS-like symptoms, food sensitivities, histamine intolerances, headaches, skin issues like rashes or eczema or dry, flaky skin that people just can't figure out why you have it? Do you have food cravings? Do you have poor nutrient absorption? Have you been told you have low B levels or low D levels or low iron levels? And you're like, I eat a normal diet. Like, what are these people talking about, right? Do you have chronic pain? Do you have chronic joint pain or joint inflammation? Mood swings, bloating, gas, acid reflux, heartburn. So like these are 2 huge ones too. Do you feel sluggish? Do you have unpredictable digestion? Okay, I want you to think about those things. So I just listed about 27 symptoms. And how many of those do you have? Okay. The sad thing is that most of you listening in this podcast probably have somewhere in the teens, if not the 20s, right? A lot of us are stressed. Most of us have issues sleeping. We have weight issues. We have weight fluctuations. We have brain fog and fatigue and anxiety and diarrhea or constipation and headaches and skin changes and cravings. I mean, mood swings. And so most of you are going to have a lot of these. Okay. Now, what I want you to understand about all of these symptoms that I just told you, here's what nobody's telling you. When you go to the doctor, you go to a provider and you vomit all these things to them, like, oh my gosh, I have da 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 da. Nobody is like stepping back and like looking at you from a big bird's eye point of view and saying, okay, why does this person have all of these symptoms, right? Like, what is going on? Like, nobody's doing that. They're just trying to like compartmentalize, like, oh, well, maybe you have an anxiety issue. Maybe you have a sleep issue. Maybe you have a thyroid issue. Like, but if you really step back and listen to somebody, the more symptoms my patients come to me and say they have, the more I'm like, 100% it's in your gut. And the more somebody pushes and says, I've tried everything and I've never gotten better, and I've done gut stuff and I've never gotten better. And like, if they really push, well, then I'm like, not only do you have a gut issue, but you probably have a mold issue and maybe a heavy metal issue. And you still have a mold and a heavy metal issue, and you haven't been able to fix that because your gut doesn't work. Because your gut is how you detox along with your liver. So what nobody is telling you about all these symptoms, what people are just band-aiding, is that they're not separate problems, okay? Your gut is your central command station, 100%. 80% of your immune system lives in your gut. And so your gut talks to every organ throughout your body via the vagus nerve. So In your gut, there is communication all day long between your vagus nerve and every system in your body. Your pancreas, your thyroid, your muscles, your brain, your heart. And so all these symptoms, these palpitations that we get, this anxiety that we get, our stomach is bloated, the joint pain, it's because our gut is actually talking to all those systems in our body. And it's doing that through feedback mechanisms of what is going on in the gut. And so all these symptoms that nobody can figure out how they relate, it's because your gut is like the Wi-Fi router of your entire body, okay? And so if your Wi-Fi goes out, what happens? There is extreme chaos, right? Like nobody knows what's going on. And the same thing happens with your gut, y'all. There's so much information, so much DNA. Our gut has more DNA than our entire body by like 100-fold. Okay, I had a podcast a few back. Go listen to my podcast with Karan if you guys didn't hear it. But he is like a gut health expert and he talked about this, like how much DNA is actually in our gut. So for us to think that we can heal people in traditional medicine or in any medicine practice at all without focusing on the gut is completely insane because you have so much information trickling through your gut. Okay, so a lot of these symptoms that people have, like let's start, I want to pick a few of them and I want to show you how they go back to your gut. Okay, so let's start with brain fog because I'm sure that many of you out here listening to this podcast right now, especially my moms, especially my women in their late 30s, early 40s, early 50s, like we're going through perimenopause. It is a ride, y'all. It's a ride no matter how healthy you are, right? I do this for a living. It's still a ride for me. So brain fog, a lot of y'all have this, okay? So let's break down how brain fog can actually be a part of your gut. Like, how is it a gut issue? Because most of the time when you go to somebody and you say I have brain fog, they're going to start throwing out like, oh, are your hormones right? Is your thyroid right? Are you sleeping okay? Maybe if they're really smart, they'll talk to you about insulin because insulin resistance is actually type 3 diabetes is actually like brain issues, right? But let's talk about how brain fog actually can be connected to your gut. So in your gut, our gut makes about 90% of our serotonin, okay? Serotonin is our happy hormone. It's made in our gut. So if we have a lot of issues in our gut where we have bad bacterial overgrowth in our gut, right? So we have all these bad, we call it dysbiosis. We have bacteria that are not supposed to be there that are feeding on things and they're growing. Those bad bacteria will steal our brain fuel. So when we eat, the nutrients that we need in order for our brain to have energy and our body to have energy are metabolized in our gut. And our good bacteria, our commensal bacteria, will help metabolize those nutrients, pull those nutrients out of our gut, and send them to our body where we need them for energy. If we have a lot of bad bacteria, overgrowth of bad bacteria, dysbiosis, for whatever reason, those bad bacteria steal our fuel. So they're like, well, we're hungry too. And if there's more bad bacteria than good bacteria, they're like, well, we're going to take our share of the food and the nutrients. And so they eat first or they eat more. And so the bad bacteria, the ones that cause you to be bloated, the ones that cause you to have diarrhea and then constipation, the ones that make your joints hurt, the ones that produce toxins, they're eating first. They're taking your nutrients. And so then your good bacteria are just scrounging around and getting whatever is left and then pushing that to your cells in your brain. And so your brain's like, hello, I need more energy than this. Like, what is going on? And you're like, I eat really well. I eat all this food and I don't understand why I'm tired. Well, your bad bacteria are actually stealing fuel for your brain and for your body. And so you end up with this low focus and this low energy. Also, these bad bacteria that are eating too much in your stomach, just so you know, they release something called lipopolysaccharide. This is a toxin. So when you have a lot of bad bacteria in your gut, and they overgrow or they're eating, they release a toxin. Now this toxin, what it does is it breaks down our gut lining. So our entire gut is at least 1 cell thick, right? So our gut lining is 1 cell thick. It's held together by something called zonulin. It's these little things that hold our gut cells together. When bad bacteria produce LPS, what happens is that LPS can go and break those zonulin bonds. And so the cells of our gut start to open up. So when we have bad bacteria and they're eating all of our food and they're producing LPS, our gut starts to open up and it becomes leaky. So this is where you get the term leaky gut. So now everything that we are eating, everything we're putting in our body, everything that's going through our GI tract is now leaking out of our GI tract. Our GI tract is supposed to be like really tight, put together. Nothing's supposed to leave our GI tract. Think about it. If you accidentally eat a food that is like toxic, right? Or a food that's got bad bacteria in it, or that's spoiled, or maybe wasn't washed well, our body is made to kill that in our gut because we have very, very guts. Or it's made to have this tight junction where it can't leave our gut, and our gut will do what it needs to and then pass it in our stool, right? Like food poisoning. If you've ever gotten food poisoning, God forbid, you know how terrible it is. Your body excretes it and then you feel better. That's how our body was made. But if you have a lot of bad bacterial overgrowth, what will happen is those cell linings open up, and then now all these things are leaving your gut. Right? So when we eat these things like dyes, blue 4D dye, or we eat processed foods, or we accidentally get a bacteria or a fungus on our food and we eat it, it can actually leave our gut and it goes into our bloodstream. Now, the problem with this is our immune system, 80% of it lives in our gut because it's chronically trying to make sure that whatever is in our gut stays in our gut and nothing's invading us. Right? Because our skin protects us. Things can invade us through our mouth, through any sort of holes or orifices in our body. And so our immune system is always in our gut, like trying to make sure nothing can invade us. So when things start to leak out of your gut because of this bad bacteria, your immune system freaks out. It's like, what is coming into the bloodstream? Like, what is this? What is this red dye 40 or this blue dye? Or what is this processed food? These chemicals we can't even say. Like, what is this? And so our immune system, it sends an attack alert. So our cytokines, which are our soldiers, they come out and they're like, oh my gosh, we got to fight. They come out with this, their sirens are blazing so that the rest of our immune system, our natural killer cells and our T helper cells and everything that need to actually help us stay well, they come to the area, right? And so when that happens, not only does that require a lot of energy, but this is happening all the time when you have leaky gut. So every time you eat, your immune system freaks out. It sounds an alarm. Your cytokines are released. Your natural killer cells, your T helper cells come to the area. Not only does that take energy, but also it stresses your body out. So your cortisol levels rise and your insulin levels rise. And so if you're somebody who's been told your cortisol and insulin's high and you're like, I don't feel stressed or I don't know why, they could be high from your gut. And if those things are chronically high for a long time, over time, cortisol breaks down your gut more, insulin breaks down your gut lining more. Both of these things cause weight gain. Both of these things cause fatigue. Both of these hormones cause you to not make other hormones like thyroid hormone, estrogen, progesterone, testosterone. And so there's this big vicious cycle. But back to the brain fog, now that I got off my little tangent, your leaky gut toxins lead to inflammation. They lead to high insulin, and that causes brain fog. And it causes weight gain. So brain fog can be from the lack of nutrients in your gut. It can also be from the inflammation that is happening in your gut from things leaking and the insulin. Because when you have high insulin and high glucose levels, it gives you terrible brain fog, okay? So if you're listening to this and you have brain fog, I hope that you now are like, oh, well, my brain fog could actually be from my gut. And so if you have pretty significant brain fog and no one's been able to figure it out, and maybe you're a Hashimoto's patient like myself and you're like, my free T3 is awesome and my Hashimoto's antibody maybe even is coming down, but I still have brain fog. My hormone levels look good. This could be why. Now, even if your hormone levels don't look good and you have significant brain fog, this could also be why. Because it doesn't matter if you give someone hormones, right? So if I give you thyroid hormone or I give you estrogen or I give you progesterone, I give you testosterone, even if those hormones are in your blood, if they cannot get into your cell to work, it doesn't matter, y'all. And it can't get into the cell if you're highly inflamed. Because when you're inflamed, your cells, the doors to your cells, they lock, okay? They're locked. Nothing's getting in there, okay? And so when you're inflamed and the doors to your cells lock, even if you've got estrogen, testosterone, T3 floating around, it can't come into the cell. And a lot of people are like, well, I don't know why my cells are locked. I don't know why, I've got hormone in my blood. I don't know why it's not getting into my cells. I don't feel well. This is why millions of you out there listening to this is why when you go to the doctor, you really don't feel well. You have every symptom of hypothyroidism. You have every symptom of perimenopause, but your labs look fine. And people are like, well, I don't know why you don't feel well. We don't feel well because you have inflammation in your cell membranes. Your mitochondria are damaged. You cannot get hormones into your cell membrane because you have chronic inflammation. And nobody knows how to check for this chronic inflammation and nobody talks to you about your gut. But think about this, we eat 3 times a day. So where is that inflammation most likely coming from? It's coming from your gut. The same thing is true with fatigue, y'all. So fatigue is basically our gut can be an energy thief. It can literally take and hijack all of our energy. So our good microbiome, our good bacteria, it unlocks calories from food and it takes nutrients how it's supposed to, and it makes us feel very steady and very full. So if our good bacteria are working well and we feed our gut what we're supposed to, fiber and nutrients, then our good bacteria take those micronutrients, they store them for energy, and then that energy is how we have, why we're not fatigued. Like, this is why we can do what we need to do throughout the day, okay? But if we have an overgrowth of bad bacteria like we were talking about, then our bad bacteria become like little energy vampires. They literally go and steal our nutrients. And so not only do we end up with brain fog, but we are literally running on scraps because they ate all of our nutrients. And so we literally don't have the building blocks to make energy because the bad bacteria ate our B12 and ate our folate and ate our iron and ate our, our iodine and just our calcium, our magnesium. And so again, those bad bacteria cause chronic gut inflammation. And then we feel chronically inflamed, or our body thinks we're chronically inflamed 24/7 because things are leaking out of our gut. And so we just have this constant drain of energy because not only are we utilizing energy in our gut from our immune system to make sure nothing's killing us, but we don't have the energy or the nutrients to move forward and actually do what we're supposed to do. Now let's talk about bloating. Okay, so a lot of you that are bloating is a bacterial warfare that's going on in your stomach, okay? I tell my patients this all the time. When your body is sending you signals, it does it in the way of rashes, bloating, fatigue. Your body cannot call you. It cannot text you. It cannot send you an email and be like, hey, Cassie, listen up. You're eating the wrong things, or you have bacterial overgrowth, or you have SIBO. It doesn't work like that. What your body does, though, is it gives you symptoms. And we ignore these symptoms, y'all. So bloating is one of those symptoms. If you are listening to this podcast and you have bloating, oh my gosh, your body is begging you to pay attention, okay? It's not just gas. It's literally a battle that's happening between your good and your bad bacteria in your stomach. So when your bad bacteria wins, they produce toxic gases that expand your stomach, that cause your stomach to be bloated, and it hurts. And if you feel like you have food babies after meals, it's your gut screaming for help. It's like, oh my gosh, when you eat, I make all these toxic things because the bad bacteria are winning. And so you have these symptoms because these toxins are being released from bad bacteria. And not only are they staying in your gut, a lot of times they're leaving and getting in your bloodstream and your blood supply because you have leaky gut. That's driving up your insulin. It's driving up your cortisol. It's affecting how your T3 gets into cells or how your body makes T3. It's affecting how you sleep because now we're not making growth hormone. We're not making melatonin. We're rolling around all night because we hurt and we're inflamed. Our brain can't shut off and go to sleep because our insulin's high and our glucose is high. Our liver starts to get mad and our liver enzymes start to elevate. We get fatty liver. Our hormones, we stop making hormones, estrogen, progesterone, testosterone. Our estrogen, progesterone are all cycled through our gut. We have something called our estrobolome that helps recycle and reuse our estrogen and progesterone as needed. And that gets out of balance. So then our hormones are either really high or really low and we have all these symptoms. And so bloating is not normal, y'all. It is not normal. And even after you have a big meal, even if you eat Thanksgiving dinner, you should not be bloated. If you're bloated, your body is asking you to pay attention, okay? And then let's talk about weight gain. One of the last things I want to tie back to your gut, okay? So stubborn weight gain. That is your metabolism hijacking your body. So I'm an endocrinologist, and I know a lot of people talk about your thyroid, right? And your thyroid is so important for your weight, and it is. But I'm here to tell you that your gut bacteria control your metabolism more than your thyroid. So I don't care if your T3 levels are perfect, if your T3 is 4.3 or 4.5, and your T4 is 1.2, and your TSH, I don't care. And your Hashimoto's antibody is undetectable, which it probably wouldn't be if you have gut issues. But if you are a thyroid patient and you are having problems with weight, or you're a hormone patient and you're having problems with weight, if you have not looked at your gut, and you do not know if you have Akkermansia, the good bacteria that actually helps us with our metabolism, if you don't know what your Akkermansia levels are, if you don't know what your calprotectin is, if you don't know what your elastase is, how you're digesting food, if you don't know what your stomach acid is, your weight is not going to improve until you fix your gut, okay? You can throw all the hormones you want at yourself. You can take microdosed GLP-1s. You can do whatever. But until you actually fix and heal your gut, you're going to continue to have weight issues. Now, you may lose a little bit of weight, but you're going to gain it right back. And the reason is because your gut Remember, it has more DNA than the rest of your body. It's going to win. It's giving signals. And so we may be able to do a few things to like trick it for a little while. But if you really want to have sustained weight loss and you don't want to lose muscle and you want to do this correctly, you fix your gut. You balance your Akkermansia, you balance your good bacteria, you get rid of your bad bacteria, you make sure you're absorbing your nutrients, that your stomach acid is appropriately low, that you're able to make pancreatic enzymes and digest your protein and digest your fat and digest your carbs. You've got to make sure the lining of your gut is not leaking. And so there are certain bacteria that can extract more calories from the same food. Okay. So a lot of you people listening to this who are like, I've been told to eat less and exercise more, and when I do that, it doesn't work. I believe you. I 100% believe you. I was there too. And we know that certain bacteria will extract more food, more nutrients and more calories from food than other ones. And so you have to make sure that your bad bacteria, that inflammatory bacteria that's elevating your insulin, we have to keep that in check. And we have to make sure our good bacteria that help promote our metabolism are also in check. So that bad bacteria, remember, it drives high insulin. That high insulin and bad bacteria send hunger signals to your brain. And so a lot of you struggle with this where you'll have random food cravings, right? That make, sugar cravings, and you crave carbs and you're like, what is going on? It can be a bacterial gut issue. So if you're listening to this and you're like, all of a sudden, I can be doing great and then I just have these terrible cravings, you need to look at your gut. You may have bad bacterial overgrowth. You may have yeast overgrowth. And until we get this in check and balance your Akkermansia, you're going to struggle with your weight. And you can do all these crash diets, you can do whatever, but if you want to lose weight successfully and keep it off and not lose your muscle mass, go to your gut. And I want you to know that you're not failing at weight loss. Like, I'm not blaming you. It's just that your bacteria are sabotaging you, and nobody has ever taught you this, okay? So what I want you to take away from what I've been rambling about for the last 25 minutes is that there's this vicious cycle with your gut, okay? Stress damages your gut. When your gut is damaged, this creates more stress. When you have bad bacteria that overgrow, this creates more stress and damage. And you just get this vicious cycle of like, I'm stressed, and so my gut is leaky, and so I'm having more cortisol made, I'm having more insulin made, and then now that more insulin and more cortisol are made, that's dumping back into making my gut more leaky, and now I have more of a bacterial overgrowth, and that bacterial overgrowth is making me crave bad food, and that's driving my insulin up higher, and it's just this big mess, okay? Now, you can break this cycle. We do it every day at Modern Endocrine. You can break the cycle, but that is the problem, okay? So if you have all these symptoms and no one's put them together and you can't figure out, why do I still feel bad? Why am I feeling bad? And why can nobody pinpoint this together? And why am I taking all these hormones and all these medications and my blood levels are normal, but I still have symptoms? It's because nobody's looked at your gut. And if they have looked at your gut, have they really been able to interpret it and explain it to you and help you understand what exactly is going on with your gut and compare that to actually your blood levels, your hormones, where you are in your life, your autoimmune condition, okay? So if that hasn't happened and you're listening to this podcast and you're like, yeah, none of that's happened and I still have all these symptoms and I'm still sick, then what's the hurt in actually trying this, right? You've tried other things. You've been sick for years. You've spent thousands of dollars probably going to the doctor, trying supplements, trying these fad diets, drinking green juice, all of these crazy things, and nothing's actually gotten better, I'm assuming, because most people it hasn't. I see people who unfortunately have been on this journey for years. And so what is harmful in listening and just trying, right? That's my question to you is just give it a try. Might as well. And so if any of this resonates with you and you're like, wow, I would probably like to learn more about this, then first of all, I want you to share this with anyone that you think, man, this person could benefit from this. They could learn from their gut. Share this with them. And then I want you also to make sure that you're following me on Instagram, on Facebook, on all social media platforms, TikTok, because I talk about this. I have a morning step talk where I talk about how different things affect your gut. I also have live webinars that I do where I teach you these things. And so I want you to make sure you're following me. I want you to make sure you share this because this is very powerful information and people don't talk about this enough. Now, the other thing I want to do is I want to today talk to you about a few questions I get from people, okay? So I'm going to go into a few questions people ask me. And then what I'm going to do is I'm going to do a second podcast episode where I actually dive into the 6 gut health types. So now that you kind of know why your gut affects all of these symptoms, I hope that you're all very curious, A lot of you at the very beginning, how many of those symptoms did you have, right? A lot of you are probably in the teens or 20s. Well, there are 6 gut health types. And if you know what your gut health type is, then the fascinating thing is you can figure out how all these symptoms are interconnected and how to fix them once and for all. And so that's what my webinar talks about. That's what we do at Modern Endocrine. We have a gut program that does this. And so if you are interested in this, then you're definitely not going to want to miss episode 2, where I actually walk through the 6 gut health types and I help you figure out which gut health type you are. Okay. But I think what I'm going to do now is I'm going to transition to a couple questions because I don't want this to be too lengthy. And then our next episode, we'll get into the 6 gut health types for sure. So a lot of people ask me with this, okay, Dr. Cassie, if I want to do gut health stuff, what sort of tests are we looking at? Is this covered by my insurance? Can I pay with my HSA account? So when you're looking at gut health information, just so you guys know, this is not something that's typically covered by insurance. I use GI maps. I use a GI map with zonulin. I think it is a very good test. GI maps are expensive. Gut health tests are expensive. But for the price point, I think you get a lot of bang for your buck with a GI map. I can look at good bacteria. I can look at bad bacteria. I can look at protozoa. I can look at yeast. I can look at fungus like candida. I can look at worms. I can look at how well you're digesting carbohydrates, fats, proteins. Do you have food allergies? Is your colon inflamed? Do you have leaky gut? So many things. H. pylori as well. So I use a GI map. It is not covered by your insurance. You can pay with an HSA account if you want to do one of these tests, okay? Now, I have people who ask me my hair is falling out and I don't know why. Will this help me? 100% yes. If you have hair loss as an issue, nobody's been able to tell you why. A lot of times the answer can lie in your gut. If you have bacteria that eat your iron is very important for hair, iodine, B12, vitamin D, all these things are important for your thyroid. They're also important for your hair. So are micronutrients. And so if you have bad bacteria that are eating your micronutrients, your hair is going to die. So 100%. And also if you just have chronic inflammation from your gut, you can have hair issues. So if you're listening to this and you're like, my hair falls out all the time, nobody can tell me why. My thyroid supposedly looks great. It's not my thyroid. What is it? Test your gut, okay? Test your gut. You haven't done it, so you might as well try. The other questions I get asked a lot are, is supporting hormones a part of healing your gut? And so hormones and gut are so related. That's how I got on this journey, right? I'm a hormone doctor. I'm a thyroid doctor. I wrote a whole book about this. My whole book is about how your gut affects your hormones. So yes, supporting your hormones is part of healing your gut, but you're never going to get your hormones exactly right if you have a really bad gut. I promise that. So if you're somebody who's been on a hormone journey, you've tried hormones, they make you feel awful or they make you feel different than how you're supposed to feel, you feel like they're maybe metabolizing wrong. Every time you take them, you have a different reaction. It's most likely because your gut is not properly processing your hormones and helping to recycle your hormones. So yes, fixing your gut will 100% help with hormones, okay? The other question I get asked all the time on social media and a lot is, will fixing my gut help me get off thyroid medication? Okay, this is a huge one. The answer to that is it depends. So if you've had your thyroid removed, right? You've surgically had your thyroid removed. Then is healing your gut going to help you get off thyroid medication? No, because you don't have a thyroid, right? But if you're somebody who has Hashimoto's, a chronic inflammatory process of your thyroid's starting to give out, then healing your gut will help. Does that mean you're going to be able to come off of your medication completely? Maybe not. It depends on where you are in your journey, right? It depends on how much of your thyroid has been basically obliterated by the inflammation by the Hashimoto's. But let's say that half of your thyroid is eaten up by Hashimoto's and the other half still kind of working. If we fix our gut and we get rid of all the inflammation that's attacking our thyroid and attacking our body, then that half of our thyroid can work more efficiently. And that T4 that's being made from our thyroid can actually convert into T3 and be accepted into our cells because now we don't have all this inflammation from our gut. So in a roundabout way, 100%, it will help you get off thyroid medication. Now, will you 100% be able to get off of it or not depends on what's going on in your body, but it will help your thyroid so much, fixing your gut, right? Because again, that inflammation in your gut is part of the reason that your thyroid is working so hard and trying to convert your T4 into your T3. Okay, so this 100% will help your antibodies go down. I see people all the time who come to me and they're like, I have high thyroid antibody levels. I can't get them to go down. Why? Well, a lot of time, I'm on LTN, my T3 is perfect, I'm sleeping, I'm not stressed, my hormones are good. It's your gut because your gut is leaking, you have dysbiosis, you have bad bacterial overgrowth, these bacteria are causing cortisol and insulin levels to be high. If you're listening to this and you're like, yeah, I've been told my insulin and cortisol are high and I don't know why. This is why. It's your gut. Okay, so my thyroid people out there, my thyroid was never controlled until I fixed my gut. The other thing I get asked a lot is, I can't lose weight. I have Hashimoto's, I have PCOS, now I have insulin resistance. Why do I keep having all these things that just like line up and line up and line up? Will this help? Again, my answer is 100% yes. This was me. I had Hashimoto's, then I started gaining weight. Then they told me I had PCOS. Then it was my insulin was high. Then I gained more weight. Then I started having infertility issues. Like, yes, once you fix your gut, you calm down your insulin, you calm down your cortisol, all these things start to reverse. I truly believe that chronic inflammation is the root cause of all chronic illness, right? Where does that inflammation come from? Yes, we have a toxic environment. Yes, sometimes people eat bad, but like, you're not constantly eating. So like, this chronic low-grade inflammation, it comes from your gut. Like, we've got to go back to our gut and fix it, just like Hippocrates said 2,500 years ago. So yes, to that person, those people who message me on Instagram all the time with this story, fixing your gut will help, okay? And it doesn't matter how much thyroid hormone we give you, how much progesterone, how much estrogen. It doesn't matter. Some of you out there, like I have patients that take astronomical amounts of thyroid medicine and still their T3 levels are low or they're not where we want them because your T3 is not being able to be converted or being able to get into your cell. So fix your gut. Will this program help reverse osteoarthritis and diabetes? I get asked that a lot as well, but a lot of people have joint pain, they have diabetes, and they're like, hey, if I fix my gut, will that actually help? 100% it will. Diabetes is insulin resistance that has gone awry, right? So when you have diabetes, you develop insulin resistant, you develop elevated fasting glucose first, right? So when you eat, your glucose becomes elevated because your insulin can't keep up. Then as your glucose continues to rise, your insulin rises. So now we've got insulin resistance, right? So we've got insulin resistance, we've got elevated fasting glucose. And then as that continues to worsen, over time, your pancreas just cannot keep up and you develop diabetes, okay? And so when we develop diabetes, it is literally our pancreas just not able to keep up. And so diabetes is 100% a result of high insulin levels, chronic inflammation, and gut issues. And so yes, this will help. And same thing with osteoarthritis. You have all this chronic pain and inflammation in your joints and this chronic low-grade inflammation that eats away at your joints and tendons. It all comes from your gut. I get asked, what should you take when you don't have a gallbladder? A lot of people reach out to me on social media and ask me about that too. I talk about this a little bit, especially with the gut health types. If you don't have a gallbladder, that is so important for fat metabolism. It also, your gallbladder is important to help prevent bad bacteria from sticking to your gut. So part of your bile that your gallbladder produces is bacteriostatic, meaning that it keeps bacteria from harming you. And so when somebody takes your gallbladder out, I'm assuming the surgeon didn't tell you, oh, by the way, you're not going to be able to absorb fats very well for the rest of your life, which can make you fat, malnourished. And oh, by the way, I'm taking out a vital organ that helps keep you from getting bad bacteria or dysbiosis in your gut. Nobody ever tells you that. They just take your gallbladder out. So there are supplements that you should take if you don't have a gallbladder, especially when you eat fatty food. At Modern Endocrine, ours is called the Dissolver. You take it about 15 minutes before a fatty meal, but it will help you absorb your fat and it will help with that bacteriostatic ability that you need to help keep bad bacteria from sticking to your gut. The other question that I got on social media recently, and when I do this presentation for people with my Gut Health Live, my Gut Health Webinar Live, is a lot of people have frequent diarrhea and frequent like constipation, diarrhea, sometimes even have urination issues. And they're like, would a gut health test actually help me know what's causing my frequent diarrhea and constipation? And the answer is yes. Like a gut health test will tell us exactly, it's like pulling up the hood in a car. Like if your car stops working, you take it to a mechanic, they don't just look at the outside of the car and say, oh, let's try this. They open the hood, they start checking things, they run checks. Like that is what a GI map is. If you're having all these symptoms and you expect someone to just band-aid it or fix it without actually truly going to the source and getting information, you're not going to get anywhere. And so if you're having GI symptoms, we need to look at your GI tract in depth, which is exactly what a GI map does, okay? The other thing I will tell you that people ask a lot about this program or just this test in general is they say, okay, if we do this test, does it test for stomach acid? The answer is yes. You can tell what your stomach acid is doing on a GI map based on what percentage of overgrowth you have. One of them is strep and staph, but we can tell whether you have good stomach acid or not based on this test, also by H. pylori. People ask me what test checks your gut lining, like how do I know if I have leaky gut? The way you know you have leaky gut is if you have a high zonulin level, which is tested in this test. So it's a marker that we look at. Now we also look at your overgrowth status, your calprotectin status. There's several things, but in the GI map, we can look at all these things. In addition to that, on blood work, I look at things like CRP, I look at things like reverse T3, I look at free T3, ESRs, so there's lots of ways you can check, but in a gut test, you can check by calprotectin, zonulin, overgrowth. I also have people say, I have had candida overgrowth in the past, and I've treated it and it's come back, and it keeps coming back. So how do I get rid of it for good? What I would say to that is, again, you need a test like this to know exactly what else is going on. So if you know you just have candida, do you know what the lining of your gut looks like? Do you know what the immune system of your gut looks like? Do you know what the acid content of your stomach looks like? All these things are going to affect whether candida can grow again. We've got to make sure our stomach is acidic. We've got to make sure the lining of our gut is intact so our good bacteria can grow. We have to make sure our secretory IgA is high so that our immune system can go in and attack that yeast if it comes back. And we have to kill the yeast. And so yeast is not easy. Again, it's not a cookie cutter thing. Like, you have to know what's going on in your gut as a whole to get rid of the yeast and get rid of it for all. I had yeast overgrowth in my gut. I know how awful it can be, and I got rid of it. So it can happen. Also, I have people ask, I have a lot of issues. Some people know they have issues with their vagus nerve, and they know that their vagus nerve is affecting their gut. They've been told they're highly stressed and that's affecting their gut. And they want to know, okay, if I actually do this test, do you know how to help heal my vagus nerve or help with my vagus nerve so my gut gets better? And the answer to that question is yes, we do that with this test as well. If we see that you have a lot of stress issues and need a lot of stress management, we do have a program at Modern Endocrine where we can help you with stress and help with that as far as your gut goes and mitigating that. Okay. So those are some of the common questions that I get. I just wanted to kind of get on here and start by telling you guys how your gut can affect all the things you message me about. I was going to go into some of the gut health types, but I think this episode's been long enough. So what I'm going to do is let you ponder on this for a little while and think about this. Like, do you have these symptoms? Do you really have those symptoms that we talked about at the beginning? Like, how many of them do you have? Have you tried things? Are you sick of this? Do you actually want to get to the root cause of things and actually feel better? And if the answer is yes, then you're definitely not going to want to miss my next episode where I go through the 6 gut health types, because I'm going to teach you about all of them. I'm going to let you figure out what gut health type you think you are, but I'm going to teach you how you actually have to test before you know for sure. And once you know what gut health type you truly are, and you can make a systematic plan that is unique to you, then I will show you that you will be able to get rid of these symptoms. We have tons of testimonials on our website. I'm going to link our patient testimonial to this podcast. I'm going to also, if you guys are interested, if you want to learn more, then I'm going to link to this podcast how you can start our 5-day gut health reset. So I'm going to do it for you for free. If you're interested, go to the show notes, click on the 5-day gut health reset, sign up for that. We'll get you in that series so you can start working on healing and just revamping your gut on your own. But make sure that you don't miss my episode next week, because we are going to go over the 6 gut health types and help you figure out how to put all this together. Again, if you found this information interesting or meaningful, helpful at all, I am encouraging you to share this with anyone that you know, because we have to get this information out. Nobody talks about this. We have to start expecting this as patients and as providers. Like, we need to heal people's guts. So please, please, please share this with anyone that you think it would be valuable. Make sure that you leave me a review. Tell me if you like this type of podcast or if you'd rather me go back to just interviewing people. Like, was this helpful? Was this beneficial? I need to know in my reviews, because that's how I'm going to know what to keep doing. Make sure you're following me on all my social platforms. I'm at Modern Endocrine, TikTok, Instagram, Facebook. Talk to me, comment, tell me what you want to learn about. Tell me what questions you have. I do step talk every morning now. When I'm walking in the morning, I will answer your questions. So give them to me. Let me know what you want me to talk about. Modern Endocrine is licensed in 44 states now. We are still pending a couple states as well. If you want to be a virtual patient, we would be happy to see you. We deal with very complex people all the time. Autoimmune, thyroid, hormones, weight loss, mold, we do it all. And so if you would like to be a patient, we would be more than thrilled to help you in your weight loss journey. And just make sure also that you Again, look at the show notes. And if you want more about this information, at least get in our 5-day gut reset because it's free and it's great information. So thank you guys so much for joining me this week. And I am super excited for you guys to come back next week and learn about the 6 gut health types. Have a wonderful week. The information presented, including any materials discussed, referenced, or linked within this podcast are for general educational purposes only, not the practice of medicine. No doctor-patient relationship is formed from you listening to this podcast or utilizing any of the information provided. I am a doctor, but I am not talking to you as your doctor. The information provided is not intended to diagnose or treat health problems or take the place of the professional medical care provided by your doctor. If you are experiencing any health problems, including problems you believe have been touched upon in any respect within this podcast, you should consult your doctor about the problems without delay. You may ask your doctor whether he or she believes the information I have provided would be helpful to you, but you should still consult your doctor immediately and follow his or her medical advice as your treating physician. I'm just here to provide you basic knowledge about the issues we discuss so you are more aware of them and can better discuss them with your doctor. That's why we call it Back to the Basics. Join me on the next episode as we continue our journey.